next up, this stuff I began creating myself, and I urge you to do the same. So what you're gonna do is go to Amazon or go to Staples or whatever and buy this type of a clipboard, right? So you could write your ACRs if you still use the paper format, but what this has is it has a compartment here that could keep all your documents, right? So what do I carry in here? So the first thing I made for myself was a sheet. Here you go. Let me see if it will focus. All right. So this is your lab values on one page, right? So I put my CBCs, my CAM7, my hematology, clotting, my electrolytes. It has the troponins, the CKMB, the PaO2 FiO2 ratio to risk stratify your ARDS patients. It has the ventilator settings, how to document them, and so forth. So I wanted to have something on one page to reference really quickly. And in addition, whenever you write stuff out, it kind of retains in your memory. So I urge you to do the same, creating your own cheat sheets or informational sheets. This way, not only will you retain the information, you'll have access to them whenever you need them. So this here is your Richmond Agitation and Sedation Scale. You could just download this sheet and have it with you. It's really convenient, and I noticed whenever I started using this sheet and had patients who were not adequately sedated, communication with the physician improved greatly because you could be objective and give them a good point and good assessment. Next one, this is from Paul Marino's ICU book, and this is your algorithm for ventilator troubleshooting. So you will have what's called peak inspiratory pressure alarm, and then you go down the list to verify what it is, such as a pneumothorax, or it might be just patient coughing, disconnect, and so forth. So obviously you have to be familiar with ventilator operations for you to use the sheet. But if you want to more in-depth about this, I urge you to buy Paul Marino's book, the ICU book, and it will explain exactly how this works. Following this, I have the Ards Net Protocol. This is the protocol used for patients who are believed to be ARDS or have pneumonia and progressing to ARDS and so forth. This is a strategy, essentially low tidal volumes and low plateau pressures with high PEEP settings, positive and expiratory pressures. So the way this chart works is you have a patient, you're obviously going to determine his predicted body weight based on height, and at the bottom there's a calculation of how to get your tidal volume, and then you'll move in tandem on the tidal volume and PEEP scale and FiO2 to make sure the patient is receiving adequate ventilation. So if you arrive at the facility and the patient who is 300 pounds all of a sudden is 1,000 tidal volume and his plateau pressures is like 50 plus, this is a good time to have a conversation with the sending physician, show him the Ards Net Protocol, and ask them, after doing my assessment, my patient is receiving 1,000 tidal volume with plateaus in the 50s. I'm concerned about his condition during transport. So this is a great sheet to have with you. Because I do both 911 and critical care transport, I have just a list of notifications to the departments in case I need to make a notification. So that's that. This is a sheet just to risk stratify your shock patients on the severity that they may be in. Next up is your search criteria. You could download this from sepsis campaign guidelines. So this will go through step by step and will list out how to risk stratify a search patient. So it will have patient's temperature, patient's respiratory rate, untitled CO2, white blood cell count, and so forth. So search criteria is essentially 2 search criteria plus a source, and this will be a diagnosis of sepsis. And this is the patients you want to give notifications to the hospital so they could initiate their early goal-directed therapy. So I urge you to have this with you. Next up is basically, this is just drip sheets on most encountered medications in the intensive care unit. Heparin, drip sheets. We have phenylephrine drip sheets. We have norepinephrine and so forth, epinephrine. And there's sedation, fentanyl, midazolam, and so forth. And so what's the reasoning behind having a drip sheet? And again, it's very similar to like the guy that explained prior. The reasoning is you want to see if the patient is getting adequate sedation, and you want to risk stratify how serious they are. Are they on low end or they're on high end? Are they getting max dose pressors? Are they getting mid dose pressors or low dose? Are they getting max dose sedation? And so forth. So you want to have a rough idea what the patient is in the continuum of on their condition, so you can anticipate changes and so forth. And the final two things that I have here is basically, this is a HeartMate pamphlet for alarms for clinicians. This is what's known as left, right, or biventricular assist device. So I work in a facility that conducts transport of patients who have these VADs, as they call them, ventricular assist device implanted in them, and they may be waiting for a heart transplant, or this may be their destination therapy. So here, it will show you all the advisories and all the hazards that the machine will pop up and inform the user of what is going on. So a lot of times the patients will be more knowledgeable than you are in terms of what's happening and how to use the device. The reason why I have this here is, let's say there is something going on, and I could find the appropriate hazard looking at the device, and I could call the receiving facility and inform them that I do have a left ventricular assist device patient. He has the following hazard showing up on his device. So they have the appropriate team members and appropriate room and equipment ready on our arrival. And this has the algorithms for the clinicians to employ. This is basically how the device looks like. Batteries on the side. Okay. And the final piece is the marquee interior balloon pump. This is just a user manual and has basic operations and troubleshooting things. If you're doing transport with interior balloon pumps, it's good to be familiar with their standard operations, knowing about the helium tank, knowing about how to transport the unit properly, how it's connected in case it were to turn off and the battery were to die, to have the appropriate syringe to manually counterpulsate so there's no clot formation and you're not showering the patients with the clots whenever it's reestablished, and so forth. So these two guides I actually got from a care representative on critical care conference, but you could go to their website, HeartMate and Marquee, and you could download. They also have excellent CME for healthcare providers. They're free, and you could watch those as well.